Hi, my name is Mark Wallingford. I am a practicing primary care physician in Maysville, Kentucky, who focuses on wellness as well as the management of chronic disease in all age groups. I was very fortunate after I graduated from Maysville High School. Interestingly enough, my goal I thought at the time was I was going to ultimately major in music. At the end of my freshman year of college, I ended up having a summer job back in the days that old Hazelwood Hospital was in existence. They used to hire college students to fill in the gap as nurses' aides and orderlies so that their employees could be on vacation. And so starting working there, you already sort of knew the docs, but you got to watch them in action performing real life medicine. And I think it was pretty quick after that summer that I decided, this is what I really think I want to do. In my job, I would have to say what I enjoy the most is my patient base. I am personal friends, I think, with most of them. I don't wear a white coat, and by and large, we're on a first name basis. It just doesn't get any better than that. I remember a night when I was working in the intensive care unit and I was just finishing up with a patient that I'd taken from the emergency room, had him on a ventilator, and finished getting my lines and stuff in, and was right at a point for the nurses to do what they needed to do. I got this urgent call to come stat to the delivery area. They had a mother that had presented in imminent labor. She was 28 weeks pregnant with twins. They were too unstable to transfer and they had to be delivered here. And then I remember going to the delivery room and I had the first baby handed to me that we could do the initial stabilization. Those babies were too little to breathe, so we had to put endotracheal tubes in so they could be bagged. And then once they were stabilized, fluid resuscitated, they were taken into the nursery where IV fluids, etc., could be added. 5 minutes later or so, when I could take the second baby, they gave me the second of the twins. I remember very well David Doty, drop scrub, went with me to manage these babies. And he would assist. We only had one ventilator for babies, so somebody had to be bagging while we had one on the vent. When I was putting in central lines in the babies, he was assisting me. But at the end of the night, we had two stable babies that were twins that were transferred out to a neonatal intensive care unit and a stable adult downstairs. Brings tears to my eyes, but when I look back, I think I pretty much did everything I knew how to do that night.